Good morning, everyone. Thank you for joining us for this first session in the WPS Medicare Education Expo. This is an all-day event dedicated to education on the topic of local and national claim determinations. This section is an introduction, so we are going to be covering the basics. Sessions will last 50 minutes so that participants will have a little break in case they registered for multiple sessions. Additional webinars will include a session with one of our contract medical directors, Dr. Joelle Vlahakis, navigating the Medicare coverage database, which is where LCDs and NCDs are stored, policy contacts, and we're going to end the day with a question and answer session. Now, I have just a couple of things to cover before we get started. The Training Center webpage is where you can find information related to the provider outreach and education team. Because this was an all-day event, we were not able to post our presentations to the Training Center like we do with other events. I emailed a copy of the presentation yesterday to everyone who had registered. There were some who registered yesterday afternoon and earlier this morning that I was able to get to, but if you were someone who registered after that and you would like a copy of what is being shown today, please contact our team by emailing the education mailbox at wps.gha.education@wpsic.com, and I'll make sure that I get that sent to you. The Training Center is also home to our Encore webpage. All of our webinars are recorded, and if there's no technical difficulties, they will be posted to our Encore presentation webpage, along with our YouTube channel. Videos are available for up to 90 days, and they can be watched on our webpage without you having to go to YouTube. So I wanted to let you guys be aware of that. So if there were presentations that you wanted to attend today, but you aren't able to get to them, we will be recording these and posting them out to that Encore presentations page and YouTube channel. Now, the provider community has responded very positively to today's Education Expo, with each session drawing large participation. Many of you submitted questions during the registration process. These have been reviewed, and where appropriate, they were integrated into today's presentation. During the question and answer session at the end of today's webinar, I will try to respond to as many pre-submitted questions as I can within the scheduled time. We will try to address all remaining questions during the dedicated question and answer session at the end of the day. If you did not submit a question in advance, but you would like to do so, you can send those into the education mailbox. I checked this morning and I did have over 400 participants registered for, and there's over 300 for each course. So we kindly ask that only new unanswered questions be submitted in order to help us manage the volume efficiently. Our goal is to provide you with an excellent customer experience. We want to know how we're doing. So later in this presentation, you will be given the opportunity to provide feedback on today's event. This is your chance to let us know how you feel, what we're doing right. If you think there's things where we can improve, let us know that. It also allows you to give us input on what types of education you'd like to see in the future. This was part of what we did today. There was a lot of people who said that they wanted more education on LCDs and NCDs. So that feedback actually got us here today. Now, while this is a CMS survey, WPS does look at our results, and we do our best to make the improvements that you ask for. Now, here at WPS, we do our best to provide you with accurate, up-to-date education. If you've worked in Medicare for a while, you know that Medicare rules and regulations can change. So for this reason, the CMS website should be checked for updates, and the federal regulations take priority over anything presented today. I also need to let you know that CMS does prohibit the recording of this webinar. We are recording this event so it can be posted as an encore presentation. The recording will be available next week if there's something you'd like to review or any materials you'd like to share. This is also an opportunity to let you know if you do not want to be part of a recorded event, You can disconnect at this time. So as the title states, this is an introduction to the world of Medicare coverage and determinations. We're going to cover the basics to help provide a better understanding of local coverage determinations, or LCDs, and national coverage determinations, or NCDs. I'll define each of these policies, discuss the processes as to how they are created. We'll look at the structure, and I'll give you some resources that I hope you'll find helpful. So let's start out with some definitions. A local coverage determination, or LCD, is a written policy by a MAC regarding whether or not a particular item or service is covered in that MAC's jurisdiction. MACs may choose to develop LCDs if there's no NCD, or when there's a need to further define an NCD for a particular item or service. Other reasons can include defining the appropriate use of new technologies, addressing services with abuse history or potential, and high volume, high dollar services. The LCD would contain only reasonable and necessary language. Here, the contractor will outline how claims will be reviewed to ensure that the item or service provided meets Medicare coverage requirements. These policies may also contain companion articles. Articles contain other languages that the MAC would like to communicate to the provider. These documents may contain billing and coding guidelines, responses to comments, or draft articles written to support the LCD. For example, WPS has an LCD written for allergy testing. The LCD gives coverage information for different types of allergy testing, but there are two articles related to this LCD. One provides billing and coding guidelines, while the other provides responses to comments that were received during the public comment period. Now, you may be wondering, how am I going to know if an article was created for an LCD? Well, you'll know because the documents will be linked to each other, and we're going to take a look at that a little later. Now, a National Coverage Determination, or NCD, is a determination by the Secretary of the Department of Health and Human Services as to whether a particular item or service is covered. These policies are created and published by CMS, and they apply to all states regardless of jurisdiction. MACs are required to follow NCDs. So, to be covered by Medicare, an item or service must be considered reasonable and necessary for the diagnosis or treatment of an illness or injury. Information that may be included in an NCD is what diagnosis might support medical necessity, when a specific procedure may be considered reasonable and medically necessary, and if there are any frequency limitations to items or services. Information found in the NCD is a little more general, which is why MACs may decide to create an LCD to further define coverage criteria. So now that we've defined the difference between LCDs and NCDs, I'd like to go through the process of how these policies get created. And we're going to start with LCDs. So here's an overview of the process. First, there must be a request. An informal meeting may be held prior to submitting a request, but it is not required. External requests can be submitted. Consultants and discussions will occur during the draft process. The proposed LCD will be published to the Medicare Coverage Database, where the public will be allowed to comment. This proposed policy can also be brought to the Contractor Advisory Committee meeting for discussion. Once the comment period has been closed and required meetings have been completed, a final determination will be made and posted. This will begin the notice period before the LCD can take effect. So now I'd like to take a little bit deeper look at each of these steps. Informal meetings are a way of allowing interested parties within the MAC's jurisdiction to meet with policy staff via conference call or in person to discuss potential LCD requests. These meetings are not a required part of the process, but they may be held for educational purposes. The goal is to assure that all relevant evidence needed for a review for coverage is submitted with the request for a formal review. Now, WPS does have a resource on our website with contact information. I'll have Jennifer add a link in the chat, but I also want to show you how to get there. So here is the homepage for the WPS website. If we go up to the Topic Center and we choose Policies, then we can scroll down here to the topic of Meetings. And there is an Informal Meetings for LCDs. Now, requests for formal meetings can be sent via email, fax, or mail, but email is the preferred method. A request for a new LCD can be submitted, and it is a different process than requesting a reconsideration. WPS will accept requests from beneficiaries who reside or receive care within our jurisdiction, as well as healthcare professionals and other interested parties doing business in jurisdiction J5, J5 National, and J8. There are some requirements that must be met when requesting a new LCD. Requests must be submitted in writing via email, fax, or written letter. There is a resource on our website that provides contact information for whichever method you choose. I will have Jennifer add that to the chat, but I want to go back to the website real quick to show you where that is. I'm going to go back to the policies page. And here we have the local coverage topic. And then we have new local coverage determination request. So here is where you're going to find that information of how to get that submitted to us. Now the request needs to be in writing. It should clearly identify the statutorily defined Medicare benefit category to which the requester believes the item or service falls under, and provides a rationale justifying the assignment. So examples of benefit categories are going to include, but are not limited to, physician services, hospital services, outpatient care, or preventive services. The requester shall identify the language they want in the LCD. This means that the request should explicitly detail the wording for the LCD that the requester is proposing, including any specific definitions, criteria, or coverage guidelines. This ensures that the request is clear and that the MAC understands exactly what the requester is seeking to have included in the LCD. A justification supported by peer review evidence is another requirement. This can include peer-reviewed literature, studies, articles, or other publications that have been reviewed and validated by other experts in the relevant medical field before publication. Full copies of the published evidence must be included with the request, otherwise the request may be considered invalid. Evidence should address the relevance, usefulness, clinical health outcomes, and medical benefits of the item or service in question. It should demonstrate a clinical benefit, such as improving the diagnosis or treatment of an illness or injury, or improving the function of a malformed body part. Lastly, documentation should be thorough, include patient selection criteria, data collection process, and attrition rates. Information that addresses relevance, usefulness, clinical health outcomes, or medical benefits should be included. You'll want to include evidence to support the medical necessity and effectiveness of a specific item or service. This evidence should demonstrate that the item or service is appropriate for the intended patient population, provides a clear benefit, and leads to improved health outcomes. Include information that explains the design, purpose, and/or method of using. Give specific details about how an item or service is intended to be used and why it is considered medically necessary for a particular purpose within the scope of Medicare coverage. This information is crucial for understanding the circumstances under which an item or service will be covered under a specific LCD. So now let's take a look at what the MAC does once a request is received. MACs have 60 days from the time the request is received to review the material and determine if the request is complete or incomplete. If the request is determined to be incomplete, WPS will respond in writing to the requester explaining why. If the request is complete, the requester receives notification and the LCD process will continue. It is important to note that a response stating that the request is valid does not mean that a determination has been made whether the item or service will be covered or non-covered. During the development process, MACs will conduct their own research and consult with experts. When consulting with experts, MACs must obtain consent and acknowledge that the expert's opinion may be used, disclosed publicly, and clearly identified within the LCD. This may include consulting with the CAC. So the Contractor Advisory Committee, or CAC, is a group of healthcare professionals and other stakeholders who advise MACs on issues related to LCDs. These meetings provide input on the evidence used in developing LCDs and help ensure that these determinations are based on sound medical advice and reflect the current state of medical practice. CAC members are typically physicians and other healthcare professionals, as well as representatives from the beneficiary and industry communities. Members are often nominated by their professional organizations and serve for a set term. These meetings are open to the public, and information regarding past and upcoming meetings can be found on our website. Again, Jennifer is going to add a link into the chat. I'm going to go back out there again. So if we go down under meetings, we have CAC meetings. So this does show you the upcoming meetings. Now here, the last meeting was held on June 26th, and because of the work that has to be done on transcripts before they can be posted, our policy department does have 45 business days to prepare the material and get it posted to our website. These meetings are also posted on our YouTube channel on the local coverage determination playlist. You can see down here there is a link to volunteer as a CAC member if that's something you're interested in, but you can go and see prior meetings. They have the agenda, recording, and transcript. So I just wanted to let you know that is all available to you if it's something you're interested in. Once the LCD has been developed, then WPS will publish the proposed LCDs to the Medicare Coverage Database, and the time for public comment and open meetings will begin. Now, the public comment period lasts a minimum of 45 calendar days, and it allows stakeholders to provide written feedback on a proposed policy. WPS does have a resource for proposed draft LCDs. A link can be found on the policy's homepage, and Jennifer is also going to add that into the chat. Here you will find the email addresses to send your written comments and a link to the Medicare coverage database, as well as steps to find LCDs written by WPS. Max will respond to all submitted comments in a response to comment article. This is published alongside the final LCD. Open meetings are another avenue to share ideas and information. These meetings discuss the review of the evidence and the rationale for the proposed LCD. Attendees are allowed to make presentations, but all formal comments must be submitted in writing. Information posted on our website includes how to submit a presentation, upcoming meetings, as well as the agenda, recordings, and transcripts from past meetings. Now, after reviewing documentation and considering public feedback, the MAC will finalize the LCD. It will be published to the Medicare coverage database along with a response to comment article. This is going to begin the notice period, which is a minimum of 45 calendar days before the LCD can take effect. This period can be extended if the MAC receives approval from CMS. If an extension is not requested, the effective date of the LCD is the 46th calendar day after the notice period began. Now, there is an LCD reconsideration process. This process allows beneficiaries and stakeholders to request a revision for all or part of a finalized LCD. In addition, MACs do have the discretion to revise or retire their LCDs at any time on their own initiative. When asking for a reconsideration, requests should include specific language that the requester would like added or deleted. A benefit category should be given along with the rationale justifying why you believe it falls within that benefit category. The requester would also need to provide justification for the change by supplying medical literature that contains new evidence that affects the content or the basis of the LCD. Our policy department prefers to receive this documentation electronically in an email attachment. Medical literature must be currently published. It should include the full text and it should be published in English. Now, due to security restrictions, our policy department is not able to open any links that are sent in the email. That's why they ask that you attach the full document. Information should support the design and purpose of the item or service, as well as the relevance and clinical health outcomes. Requesters are strongly encouraged to include an analysis of any relevant peer-reviewed medical literature that qualifies and or describes any health disparities related to the specific LCD reconsideration request and how the requested change may impact health disparities. There is a resource on our website which can help you with this process. A link can be found on the policy homepage, and Jennifer will also add one into the chat. Once received, policy staff will review the materials to determine whether the request is valid or invalid. A written response will be sent to the requester within 60 calendar days as to whether the request is valid. If the request is invalid, the written notification will include an explanation as to why the determination was made. If the request is valid, WPS will open the LCD and follow the process outlined earlier, or include the LCD on a wait list for prioritization. The prioritization process will look at things such as claim data, like how often a service is billed or denied, access to care, and potential health outcomes. Requesters will be notified in writing if the request was accepted or whether it was put on a wait list. Interested parties may also be contacted if the contractor medical directors have any questions or need further clarification. So next we're going to move on to the NCD process. Remember, NCDs are national policies created by CMS, and they apply to all providers regardless of jurisdiction. The complete process usually takes between 9 and 12 months. As with an LCD, the NCD process begins with a formal request, which can come from an outside party or CMS staff. Outside parties can include a Medicare beneficiary, manufacturer, provider, supplier, medical professional association, or a health plan. The request will be reviewed by CMS staff. Sometimes these reviews may include an external technology assessment or a Medicare Evidence Development and Coverage Advisory Committee, or MedCAC, meeting. The time frame officially begins when CMS formally accepts the NCD request and informs the public that an item or service is under consideration by posting a notice, referred to as a tracking sheet, to the CMS coverage website. This will open a period for public comment. A final decision will be published, as well as implementation instructions, within 60 days after the comment period closes. Now you can see that the process for submitting a request for an NCD is much like that of an LCD. Requests must be submitted in writing and clearly defined as a formal request for a national coverage determination. The request clearly identifies the statutory defined Medicare benefit category to which the requester believes the item or service falls under. Now remember, examples of benefit categories are going to include physician services, hospital services, among others. The requester may recommend one or more benefit categories for an item or service and submit supporting documentation justifying the recommendation. If an item or service can fit into more than one benefit category, CMS has the discretion to assign it to the most appropriate one. The requester should submit adequate supporting documentation along with the formal letter, including a full collection of the supporting medical and scientific information currently available that measures the medical benefits of the item or service. Like the LCD process, supporting documentation should address the relevance, usefulness, or medical benefit to the Medicare population, as well as explain the design, purpose, and method of using the item or service. Now, earlier I mentioned that during the NCD analysis, CMS may include an external technology assessment or a Medicare Evidence Development and Coverage Advisory Committee, or MedCAC, meeting. I do want to take a minute to explain those in more detail. A technology assessments are systematic reviews of evidence conducted by CMS staff to review relevant evidence and make a determination if the item or service is reasonable and necessary. So to minimize bias, these reviews perform a comprehensive search of all potentially relevant medical and scientific articles. Evidence is evaluated to determine its credibility, clinical relevance, and level of impact. CMS may determine that an external technology assessment is necessary for cases where there is not an extensive body of evidence to review, if there is a disagreement among experts, or the review requires unique technical or clinical expertise that is not available within CMS staff at the time of the request. The Medicare Evidence Development and Coverage Advisory Committee was established to provide independent guidance and expert advice to CMS on specific clinical topics. The MedCAC reviews and evaluates medical literature, reviews technical assessments and public testimony, and examines data and information on the benefits, harms, and appropriateness of medical items and services. They will determine the strength of the evidence given and make recommendations to CMS based on that evidence. The CMS encourages public comments and the submission of any additional evidence as it increases the quality of the decisions that are made. Depending on whether or not technology assessment or MedCAC meetings were conducted, a proposed NCD will be published within 6 to 9 months of when the tracking sheet was posted. The public comment period is required to last 30 calendar days. Material submitted may include recommendations from medical societies, published articles, clinical trials, as well as individual practitioners or narratives of patient experiences. CMS uses public comments when making their final determination and responds in detail to all comments received when issuing a final decision memorandum. If you would like to see what documents are available for public comment, you can visit the Medicare Coverage Database and look for National Coverage Analysis or NCAs and Coding Analysis for Labs or CALs that are open for public comment. A link has been provided on the Helpful Resources slide. Now, NCDs also have a process for reconsideration, which will follow the same, that has the same process flow as requesting a new NCD. Requests will be accepted at any time, but the requester must provide documentation that provides additional scientific evidence that was not considered during the most recent review, along with justification that that new evidence may change the NCD decision. The requester should provide a valid argument that there is new evidence or that CMS misunderstood or misread the existing evidence at the time the NCD was decided. So next, we're going to spend a little bit of time on the structure and the contents of an LCD and NCD. One thing to remember is that not all LCDs and NCDs look the same. They aren't going to have the same sections populated, and they are going to look a little different. My intent is to give you general guidelines of information that can be found when looking at these documents. So I've listed the sections of the LCD, but I'm going to provide some additional details on those sections that I feel are important. So under the LCD title, you're going to find a section titled Contractor Information. And actually, we can go ahead and look at one. I'm sorry, give me just one moment here, and I'm going to go out to the Medicare Coverage Database so that you can actually see what it looks like as we go through it. We are going to have a webinar on this later today that will go through the navigation process of this. So if that's something that you're interested in, but I do want to pull one up just so you can see. I am going to go directly to the WPS to our LCDs, and I'm just going to pick one so that you can take a look at it. So here we have contractor information, and this is going to identify the specific MAC who is responsible for the LCD. Remember that LCDs only apply to healthcare providers and beneficiaries within the MAC specific jurisdiction. This information is going to be helpful if you are on the Medicare Coverage Database searching by a topic. This section will also provide you with contact information in case you have questions regarding the content. So if I click on here, it's going to give you our contractor name, our address. It has the medical director and the states covered. these are broken down into contract numbers. Oops. Okay, so next we have the LCD information section. And here's where you're going to find the LCD ID and title. If you're looking at a draft LCD, this is going to be a DL instead of just an L. You're going to find, oh, here's a link to the draft if that's something that you would like to see. Now, this is where you're also going to find effective and revision and retirement dates. There is a CMS National Coverage Policy section, which outlines whether a specific item or service is considered reasonable and necessary by Medicare. If an NCD exists, the LCD must align with it. If no NCD exists, then the LCD will set coverage guidelines for the specific jurisdiction. Okay, let me go down, sorry. I want to do this kind of quickly for you guys. Oh, also in the LCD information, it's going to provide you with coverage guidance. This is going to outline the specific criteria that determines if an item or service is considered medically reasonable and necessary. And it's going to clarify the circumstances under which a service will be reimbursed by Medicare. Information can include specific conditions or diagnosis for coverage. If there are limitations such as treatment settings, frequency, or duration of treatment, these will also be listed here. This section also clarifies reasonable and medically necessary care. Like I said, all LCDs are different. So here you can see coverage, indications, limitations, and or medical necessity. Summary of evidence. Sorry for the scrolling. I want to get you guys through this so that you can see all of the different categories. So the general information section of an LCD typically outlines the purpose, scope, and development of the LCD. Here's where you're going to find documentation requirements needed to support claims for a covered item or service. Next, you're going to find revision history. This allows transparency by giving revision dates and providing a summary of the specific modifications that were made. It even includes reason for the change. Now, under the associated documents, you're going to find links to related LCDs and articles as well as NCDs. At the start of today's webinar, I mentioned that articles will contain billing and coding guidelines as well as responses to comments. So if you're looking for that type of information, you're going to want to pay attention to this section. Here you can see this does have an article with billing and coding information. There's also a response to comments. Lastly, there's keywords. This is if the author would like the LCD to appear when people are searching specific topics. Okay, next. We're going to look at the structure of the NCD. It looks a little different, but it does contain similar information. So the NCD begins with tracking information. I'll take you back out so we can look at those. We'll just click on one. So the tracking information gives you the publication number, manual section and title, version number, as well as effective and implementation date. Now, there may be times when you're looking at an NCD and you'll notice that the effective date is not the same as the implementation date. The effective date is when the policy becomes active and can be enforced. The implementation date is when the MACs must have system updates and business processes in place to enforce the new policy. For example, a new NCD might have an effective date of January 1st, but the implementation date could be several months later, and that's going to allow for system updates and training within the MACs. This can sometimes lead to claims being held or being mass adjusted. Some of you might be familiar with those processes. Next is the description information. This section outlines the specific item or service that is subject to the coverage decision, providing details about its characteristics, purpose, and how it's intended to be used. There may be links under the claims processing instructions. If we scroll down, so under here, this is going to take you to a change request, or what some might refer to as a transmittal, and that's going to provide you some additional information. You may see a section titled National Coverage Analysis or Coding Analysis for Labs. This occurs when the NCD has been or is currently being reviewed. You'll then find a link to that related NCA or CAL. Here, this one does actually have an NCA. So this is either has been or is currently being reviewed. So it gives you that information. Lastly, there is the additional information section where you can find supplementary details and references. If there's an earlier version of the NCD, you will find links to the previous versions here. Now, I have provided some resources that I hope you'll find helpful. Now, first, we have the Medicare Coverage Database website, which is where we just went. This is where the MACs and CMS post their LCDs and NCDs. There will be a navigation webinar held at 11 o'clock Central Time for those who are interested in learning that tool. Some resources I have are specifically related to LCDs, where they can be found. You'll see that the WPS policy homepage, which is where many of these links that we looked at earlier can be found. WPS did create a code lookup tool that allows you to find LCDs, articles, and NCDs by entering codes or keywords. That is on our homepage. So that would be something that you could find there. Now, one resource that I would like to point out on this slide is the Medicare National Coverage Determination Manual. The chapter is divided into 4 parts, so it is helpful if you know the NCD number. I sometimes use the manual because I personally find it's easier to read than the actual NCD. Now, you're not going to get all the related links. It is going to be only the coverage information that would be found in the description information section. But that is something that if you don't want all that extra information, you just want the coverage, you can go there. Now, I do apologize. I do not have time for a question and answer session. We did download all of the pre-submitted questions. We will have a question and answer session later, and we are going to get to your questions and get those out to you. There was just a lot of material to cover today. After the close of today's webinar, you will receive a thank you for attending email. There are 2 sections I would like to call your attention to. The first section, titled Your Opinion Matters, gives you an opportunity to provide feedback if you've not already done so. The second section, titled Certificate of Achievement, gives you proof of attendance and contact hours that can be submitted to your crediting organization for continued education units. If you do not get this email, please check your spam or junk folder. You will also need to add messenger@webex.com to your safe sender list to avoid issues in the future. Now, if you joined only by phone, you will not receive this email. So in that case, please send an email to the education mailbox with your name and the phone number that you used to join, and we will send a certificate to you. Now, if you think of any questions after the webinar, you do have 7 days to send those in. Again, we do kindly ask that only new unanswered questions be submitted, and that will help us manage the volumes. When you disconnect from the webinar, you will be redirected to a CMS survey. I'm also having Jennifer add a link in the chat. Your feedback really does mean a lot to us. We review what you have to say and we do our best to make the changes you ask for. Again, this is also an opportunity for you to let us know what education you'd like to see in the future. If there's something specific, please tell us. Like I said, this whole day was created because of survey feedback. The redirect is going to look like what you see here on the bottom. We don't have control over how this appears, so we just wanted to let you know it's not spam, it's nothing malicious. It's just going to take you to the CMS survey website. We have made some recent changes based on survey comments that we want you to know about. We did add chapters to our YouTube that will allow you to quickly navigate our videos, and we've also added training indicators to our webinars when we advertise them, so that it can help you maybe find out a little more if it's pinpointed for what you're looking for, the education that you want. That brings us to the end of today's presentation. On behalf of myself, Jennifer, and the Provider Outreach and Education team, I'd like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.